Prince George's County is one of the most diverse and populated counties in Maryland. It borders Montgomery, Anne Arundel, Howard, Charles, and Calvert counties. The growing population in PG is around 909,535. Of this population, approximately 9.2%, or 83,677 people, live in poverty. Over 1/10 of the population in PG is not covered by medical insurance. Prince George's County, in comparison with its neighboring counties, has the highest population of people in poverty and the highest population of people that are uninsured. Poverty is a driving factor in limiting medical access for the poor.
People who do not have health insurance often have to pay out of pocket for health care. So if they have a minor illness, they may not seek medical attention, and the illness can get worse, or complications can develop, and therefore the patient is sicker by the time we see them, or by the time they're seen in a hospital. Their degree of illness is much more severe.
An article published in The Guardian recounts the story of Diamante Driver, a 12-year-old boy from PG County, Maryland. He came home from school on Thursday, January 11, 2007, with a horrible headache and was taken to the hospital, where he was discharged with only a few prescriptions for medicine. He went to school the next day and was back in the hospital. This time, he was diagnosed with meningitis. They rushed him to Children's National Medical Center, where he underwent brain surgery, twice, to remove a bone where the infection had spread to the left side of his brain. They discovered that a molar on the upper left side of his mouth had started it all. This tooth was infected to the core. Bacteria from the abscess had spread to the boy's brain. On Sunday, February 26th, Diamante Driver's mother, Alice Driver, received a call from the hospital. "When I got there," she said, "my baby was gone." Alice Driver worked multiple jobs, none of which provided dental insurance. Both she and her children were not covered, and nor could they afford the $80 procedure that could have saved Diamante's life. Stories like Diamante's are very common amongst the uninsured. From dental to neurologic and even cardiac, patients suffer the timely consequences of not having medical access.
I can think vividly. I have patients who have very difficult to control blood pressure, but because they may not have access to care, what initially started out as something like their blood pressure's too high. By the time they end up getting treated, I've had several patients where they don't come in with just high blood pressure. They may come in with kidney failure. Now they automatically qualify for Medicare or Medicaid, and then we can treat them, but of course now it's going to cost hundreds or thousands of times more than if you had just treated their blood pressure initially. And that's something that's incredibly preventable with good access to medical care.
Due to a lack of communication about medical insurance programs for low-income families and a lack of education for those in poverty, low-income households in Prince George's County have a hard time understanding the process of obtaining health care. Without access to these programs, low-income families are hesitant to visit the doctor, as they cannot afford the costs of medical care. These families do not know where or how to start the application process for insurance programs. In the long run, the impact of having no health care will take a huge toll on these families. To make matters worse, Prince George's County has the lowest number of primary care physicians in comparison to neighboring counties.
Because we have a county that is diverse, it's also a county that you have a greater range in population. You may have the county may not be as affluent as some of the other neighboring counties, but it has its pockets that are even more affluent. But sometimes because of that, the county can get a stigma, and it can be like some physicians may feel, well, I'm not going to work there because it's not quite as affluent as, working in Fairfax, Montgomery County.
Relatively few primary care physicians practice in poorer areas of the county. Moreover, the county has only one federally qualified health center, Greater Baden Medical Services Incorporated, which serves uninsured and low-income patients.
One thing that is unique about my organization, that's who we targeted, the vulnerable population. So while we are a community health center, we receive federal funding for what's called an A330 grant that makes us a federally qualified health center. So we take care of that vulnerable population and we reduce the access for them so their co-pays run for $20 or $30 so that they can get in for care, and then we write off the rest of their visits.
Being dubbed the most affluent African American county in the nation has overshadowed the numerous pockets of poverty that lie within the county. The poverty found here correlates with the access of health care. Being below the poverty line denies the support low-income families need to a stable and credentialed healthcare program.
Prince George's County, where we're in the top 10 when it comes to median income. When it comes to income, you can be riding through Woodmore Estates, $10 million homes, and then go 5 miles down the road and you're in poverty. And those pockets of communities are right next to each other. So when people are looking at Prince George's County, all they see all those numbers of the taxes and how much money people make.
Of those in poverty in Prince George's County, thousands attend public school education. On a national level, 15% of all U.S. children under age 17 remain uninsured. Studies have shown that a child's access to medical care can affect their performance in school. A student who is suffering from an untreated condition can experience greater stress, as well as mental and psychological issues.
For students, a lot of the stresses are, and I think the American Academy of Pediatrics this week reported on new guidelines for identifying students at risk for depression and suicide, and access to mental health care. Just making it a routine part of a student's life, that, hey, you have an opportunity to not just go to the counselor, but for people to discuss it, I think can help deal with the stress. Giving people ways to cope with stress early helps them to cope with stress later, so we don't have to deal with as much disease.
Students without access to medical care are often victims of chronic absenteeism. Chronic absenteeism is widely defined as missing 10% or more of school days in a school year for any reason, including excused and unexcused absences. This can translate into missing 15 or more days per year or 3 days per month. Chronic absenteeism is common among students who live in poverty. In fact, students from low-income families are 4 times more likely to be chronically absent than middle-class students. A reason for these constant absences from school can be traced back to a lack of medical care.
And instead of going to the doctor and getting something that's minor, not out his child, I've seen some kids that actually do have access, but because mom, dad, aunt, or whoever it's okay, it's all right, you'll be okay, and something that could be minor has turned into something that's worse. They don't have it, they are scared to go because they don't have it, and they don't want a bill, because that's one friend said, I don't want a bill, so I'll just kind of do some herbal stuff. I'll look on Google, see if I can treat it myself.
Research suggests that U.S. school children with treatable and remediable conditions miss a combined 14 million days of school each year. But it doesn't stop there. The effects last much longer than the classroom. Students who are chronically absent in preschool, kindergarten, and first grade are much less likely to read at grade level by 3rd grade, which would make them 4 times more likely to drop out of high school than proficient readers. A student who is chronically absent any year between grades 8 and 12 is more than 7 times more likely to drop out. On average, a college graduate is likely to live about 9 years longer than someone who has not completed high school. What are some options for those seeking medical access? On November 30th, 2017, NBC reported that the construction of the $543 million medical facility, the University of Maryland Capital Region Medical Center, was viewed as a hope for the county to gain more well-trained doctors and decrease the number of the current 80% of residents in Prince George's County who view medical access as a big issue. Each Prince George's County doctor potentially has 1,910 patients each. This is high compared to the 880 patient per doctor ratio in neighboring Washington, D.C. Children's National Medical Center is another medical option for those who are uninsured.
In a children's hospital, we don't turn away any patients, whether it be race, based on race, gender, ethnicity, or financial status. Everybody is given medical care. And so you go to children's hospital, you're going to get care.
All of these services are great if you know about them. Unfortunately, a majority of residents in poverty are not aware of the options they have for medical care.
Tough navigating the insurance world if you're not savvy enough or you don't know where to go to get the tools and support. And that's one thing about us. We have social workers and case managers that work with our patients to help them navigate to where they need to be. We really work hard to meet the patients where they are, and we do a lot of education training classes. We have support groups because of that, because it's not just about their illness. It's about, I just need to be able to make it day to day and cope. And I struggle about not having people around me that understand that and teach me tools so that I can get out of that cycle that I'm in.
Organizations such as the Prince George's Healthcare Action Coalition are dedicated to serving as a community health network to advance the state of healthcare in Prince George's County.
If you are in poverty and no one knows that you're in poverty, then you're in poverty all by yourself.
Going by this principle, we attempted to contact the PG Healthcare Action Coalition, but we found that there's an evident disconnect between these organizations and the residents of Prince George's County.
You have reached the voicemail of Amity Glover with the Prince George's County Health Department. Please leave a message and I look forward to getting back to you soon.
Bridging the gap between the impoverished and uninsured residents of Prince George's County and healthcare professionals has proven difficult over the years. Full coverage healthcare is as scarce in PG County as the physicians. Most importantly, students without these health benefits take the toll in and out of the classroom. Whether it's worrying about when you will get your next meal, the consistent hitch in your breath, or the math test you have tomorrow, an impoverished and uninsured child has a lot of worries. Most importantly, they're tossed through an unruly cycle of poverty. Recent political actions, such as the elimination of Obamacare, will have an effect on today's youth, tomorrow's youth, and those yet to come. This hamster wheel of poverty and lack of medical care has to stop. We need to stop running with the limited health benefits, high medical costs, misinformation, patient-to-professional disconnect, and simply ignorance. We have to think about today's youth, tomorrow's youth, and those yet to come.